How's it going, everyone? Josh here again. This is my first video officially, and we're going to be talking about the vaccine mandate, some of the information that's out there, and really more from the way that the mainstream media is pushing it and how that's represented in big tech. And so I have a few examples that I wanted to kind of highlight today as things that I was going through over the weekend. The first one I wanted to share was this one that I'm sure a lot of people are aware about, and it's really relating to the propaganda and the way that they've incorporated Sesame Street, I think, to downplay some of the risks or to create a more perception with parents that this thing is normal and maybe a no-brainer as it relates to the cost, risk, benefit, right? And I put together a list as we kind of go through this of pros and cons with the vaccine, with the information that's out there today. And I'll go through a lot of sources that I think not only substantiate this, but there are a lot more sources beyond what I'm going to cover that I think really illustrate this. And so let's go through the cons and then we'll go through the pros, right? The cons being that with the vaccine, you're still able to get COVID-19. They call it the breakthrough infections, right? And so they've even gone as far as changing the definition of what a vaccine is and changing it to something along the lines of a vaccine is something that stimulates or generates an immune response and not necessarily prevents someone from getting the COVID-19. Another thing with COVID-19, you're able to still spread it, which kind of goes into some of the OSHA regulations. I was kind of curious, and I'm just trying to understand, and something I want to share is how does OSHA have the authority to bake in as quickly as they did without any sort of legislative control the mandate to, let's say, force employers to require their staff to get vaccinated or face huge fines and penalties. And we'll go into some of that. And I think there is a concern with OSHA being able to swing around a broad brush like that to essentially, really it boils down to putting pressure on the citizens of this country. There should be no government agency that puts that degree of, let's say, legislation or mandate over the freedoms of the citizens of this country. And that should concern a lot of people. So we'll kind of go into that. So with COVID-19, you're still, or with the vaccine, you're still able to spread that. There's no long-term data showing overall safety of the vaccine. And there's acknowledgments of that. There's a video from MSNBC where it's a video. Let me see what the name of it is. We're going to be talking about this one too. It's called For Facts Sake. You come on, people, for facts' sake, get your facts straight. And they come out and say to a question, is this safe for my child? The first thing that's said is there's no long-term studies. So you know what? It's a roll of the dice, apparently. And the answer, I've heard answers like that in the past, and that answer basically means a whole lot of nothing. Let's see here. There was, I think, Kamala Harris talking about the economy, and it was kind of like that. Basically, just a no-meat sandwich. So, what are some other? So we have 3 cons so far. I'll restate that. Still able to get COVID, able to spread COVID. No long-term data in regards to safety. There are vaccine side effects that are not represented or fully acknowledged by federal agencies, CDC, FDA, or the media. Myocarditis is one of the big ones that has a lot of risk and is really underrepresented. Even when you go on the CDC website, it's really hard to find, from what I've seen, and I could be wrong here, but I've gone through this CDC website, and it's really hard to find where that's represented. A lot of it kind of puts what the low risk, side effects are, and it says that more severe risk can occur, and those are what they classify as rare cases. But I don't know if that's fully being represented, so I would definitely consider that a con of the vaccine. COVID restrictions are still being enforced, and that's lockdowns, masks, even though you do get the vaccine. And as you see spikes, and as you see the efficacy wane, it seems like we're already kind of seeing some wins of this, where even though you have the vaccine, the goalpost is going to change, or you still have to follow these mandates because it really hasn't done anything to prevent the spread. So that's another one. COVID has a very low mortality rate in adults, approximately 1.5%, if you look at the numbers in a lot of cases. And that's just comparing what has been tested with tests that don't seem very reliable in the first place. And what about the people that haven't been tested, right? So when you're looking at the numbers, it's approximately 1.5%. I think that's relatively low considering the risks, the untested nature of the vaccine, how long it takes to test a vaccine versus how long this one was allowed to be tested before putting to market. And then with kids, COVID has an extremely low mortality rate, especially in kids, which is really, as a parent myself, definitely gave me a lot of peace of mind early on. But when they started pushing the vaccine, the thing that really concerned me was now they're talking about the kids when, there's really, as a parent myself, there's no way I'm giving, my kids that vaccine, considering the lack of testing, the lack of understanding, and versus what has been shown as far as a reaction to a kid getting COVID. They're basically show typically no symptoms at all, and I'm expected just out of fear, and I think this is what propagates, right? This is what the media propagates. Just out of fear, I'm supposed to, just react, not look at the facts, and just jump on this bandwagon apparently. And again, there's a lot of media information out there that's really pushing it like this is the best decision. Every parent has the right to make their decision for their kids, and when I look at the facts, my own personal decision is this doesn't make sense. And there's not only myself, but there's videos that I'm going to share here where I think even doctors are saying the kid thing doesn't make any sense. The age group of 5 to, I believe it's 11. I could be wrong there, but yeah, it's that's another one. So let's see here. Waning efficacy of the COVID vaccine requires booster shots for currently undefined period of time. So who knows how long we're going to be on this booster bandwagon of a moving goalpost to keep on addressing efficacy for something that's already legacy and outdated. Doesn't do anything for Delta. With the exception, and I'm saving it for the end, the pro, so we'll get there, right? But you got the waning efficacy. The FDA approved licensed vaccine, so the Comirnaty, that is not available today in the U.S. And so people have been told that there's this licensed product out there. But that licensed product is not what people are being given. People are still being given the EUA, and this is where you get a lot of the fact checkers that come in and they're like, oh well, in the on the label or on the CDC website it says that they're chemically distinct or something like that. That to me, should concern a lot of people. And especially considering that they even changed the, the makeup of the vaccine with the tris substrate that they've added to it. But just even beyond that, the fact that they've licensed this, the vaccine, Comirnaty, and that's not out today, and people are still being issued this, these prior, EUA vaccines that, from an FDA, CDC, and from a Pfizer perspective, or let's say these vaccine manufacturers, the only thing that I really have to swallow is these things are basically chemically distinct. I don't know how much I believe in that, especially with the way that it feels like when you're talking to one side of it, the media, when you're talking to it from the CDC, the FDA perspective, it feels like you're being talked to like a child. It feels like you're not getting much in the way of transparency. It feels like you're not being given much in the way of data that really speaks to what is actually being represented. And a lot of times in the independent media, in other sources, and I think other doctors out there that are being misrepresented. And I have some interesting information to share on that as well. But it's just this big tech, mainstream media, and I would say government that has just lost its way. Government not for the people anymore. Government for, I don't know if it's lobbyists. I don't know if it's for the drug companies and incentives that are behind the scenes, but it's not right. And this is an example of where I wanted to come out and kind of start sharing some voice in this because it's the only way I can start to get involved. I can't sit idle anymore and just watch this thing and complain about it. Let me start here and see where it goes. So the next one for the cons is the vaccines will no longer be able to support the population achieving herd immunity, right? So I think we're pretty much in this endemic phase, and this vaccine really isn't, I think, offering much in the way of that space of it. And then one more. The current vaccines being administered are all EUA vaccines, and drug companies, governments are not liable for any damages that occur as a result. So definitely not interested that if you get some severe condition, you're unable to work, there's very little chance you're going to get anything in the way of compensation or liability. Doubt anyone's going to be held accountable. So definitely not interested in it doesn't really make a lot of logical sense to me, honestly. And bonus con, who trusts Pfizer? There's the bonus con. I definitely do not trust Pfizer, and my trust in the FDA, CDC at this point is pretty questionable, if I'm speaking candidly. So that's the con list. So we got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 cons. And so what's the pros? What are the pros? The pros, and I've talked to people about this too, but it is said out there that your symptoms will be less severe. So that is the pro. That's the only pro that I've been able to find. And so a lot of people talk about this risk versus benefits. And maybe I can get my wife to help me do some editing on this one, because I'd like to be able to splash down some cons and then have the pros on one side just for a visual representation. But there we go. That's what we got. So that's the list. So we'll try to get to the point here. Make this succinct. Going back to my list here. So something I'm going to talk about is, the Sesame Street video, right? I think it's pretty unfortunate that, and I'll put all the links to this in the comments section or the summary sections, whatever. I'm new to this, right? So I'm going to start with BitChute, YouTube, and Rumble. Probably post this tomorrow once I'm able to get some, overall edits or things like that done. Might take me another day because this is me kind of starting off. So hopefully these will speed up a little bit going forward. But yeah, you got this Sesame Street video, and just the way there's this Q&A section.
A lot of kids I know also want to know why it has to be 2 shots. Sanjay, you have a little demonstration for us.
Yeah, so that, they call this the prime and the boost. So think of it like this umbrella, the first shot is sort of your prime. You get some protection against getting wet. And then the boost, which gives you stronger, longer, and wider protection. So that's the 1 shot versus 2 shots. Hopefully the protection lasts a long time.
Okay, so in the Sesame Street video, the first thing I want to talk about is it's part with Dr. Sanjay. He talks about the protection you get, and it's interesting because I've seen this in a lot of the talking heads type I think videos in the past, where it kind of takes the concept of the Mockingbird media, and there's been like kind of snapshots where it shows basically a single topic and the way that topic is talked about, the talking heads, and you basically see it the same thing being said over and over and over and over again, and just different types of news agencies and media, which again, it's more than just coincidence there. And I just noticed this now in trying to look at what areas of this video I want to talk about. But I was reading a CNN article, and it was about an opinion piece about, is it safe for me as someone who's vaccinated to go to a family member's, let's say, gathering for Thanksgiving with unvaxxed people? I think the fact that an article like that has to be written, again, is a little special in one way, but the part that it really ties to, why I talk a little bit about it is because the analogy they gave there was very much like what they gave here in how people are protected from the vaccine, right? And so in this article they said that basically with the vaccine, and it's raining outside, and they, I guess, relate the rain to the virus. If I go outside, me having the vaccine, I have a raincoat, right? And there's a chance I could get wet, but I'm protected, right? To some degree that a raincoat protects me. This is a vaccine we're talking about versus a virus. That doesn't feel too confident to me. I mean, honestly, it seems like it's not really going to do much. And then they talk about the, like now if it's really heavily raining, it's like a thunderstorm and you got this raincoat on, then it's not really going to do much, is basically what the analogy says in that article. In this video with Sesame Street, they're talking about the booster shot, and so he's got an umbrella on, and he's like, with the first shot, the umbrella's kind of closed, and he's like, with the booster, he pops open the umbrella, he's like, boom, maximized, optimized. Now you're protected for longer, right? So what's longer? I think it's unfortunate that the way that they're talking to people about this really comes without any facts, because again, it's not tested. And it's insane that honestly, from what we've seen, it seems like it's 3-4 months. So 3-4 months, maybe 6 months, you're looking at a booster to boost something that doesn't stop COVID. All right, the last piece I'm going to talk about with this video, and then I'm just going to move on from the topic because I really don't want to spend a lot of time talking about Sesame Street. But the reason why I did talk about it, because I think it's really unfortunate the way that Sesame Street is being used to market the vaccine and being used in a way to influence public opinion about the matter. It's just, again, really unfortunate. But there's this part where the kids are able to ask questions, and they have one of the vaccine makers come on and answer the question. And just, she said that basically in the video that the vaccine is supposed to prevent kids from getting COVID, and that's just not accurate. So they come out in the video and say something unfactual, and hopefully, if I can, we'll see if there's any fact checkers out there. Maybe we'll post it on a few Twitters or something like that to see if that video gets a good old fact check going from the fact checkers. We'll see.
See you.
We are so excited to have you here.
It's so nice to see you guys too.
We have so many questions, Dr. Corbett, as I'm sure you can imagine. Let's start off with our first one. This comes to us from Lucy in California.
How did the scientists make the vaccine?
And here we have a scientist who helped make one of the vaccines. How did you do it?
Wow, that was a really good question, Lucy. Oh, with so much work. But scientists found out over tons of years of research that if you put two components together, you can make a really good vaccine. So the first component is just a message. It is a message that goes to your body to tell your body how to make a really good response in order for you to fight COVID. And the second component is a ball of fat. So you get a message wrapped in a ball of fat, and that ball of fat just allows for that vaccine to go into your arm very safely, to go to the cells that it's supposed to go to, so that we can prevent you from getting COVID.
Okay, now I want to talk about this MSNBC video, and they have Dr. Kavita Patel, a primary care physician and former policy director in the Obama White House, talking to someone in MSNBC. I don't know who. I don't watch MSNBC, but I guess more recently I've been watching these things just to be, again, able to really represent what's going on, maybe to the people that are watching this thing here, or to represent how some of the things really are just being, I guess, misrepresented. I also, just before I get into this one, I find it interesting. There's the recent YouTube feature that they're going to be looking to disable around the dislike button. I'm surprised, actually. This MSNBC one allows the comments, so that's good. At least they allow the comments. I know there's other avenues. The Sesame Street video had theirs disabled. I could only imagine the comments in that one. And I think whenever you have comments disabled, you generally got to question, why are they kind of afraid of what might be said? I get that there's some trolls out there, but ultimately, when you look at the comments, I think it does represent a good portion of opinions out there that I think are good opinions and fair questions. The likes versus dislikes here is pretty atrocious. 813 likes, 7.7K dislikes. I don't think that's too much of a surprise. So in this video, there's a question, and the question was there sufficient testing done?
This all happened extraordinarily quickly, which is a good thing. I mean, triumphant for science. But I know there are a lot of parents asking, was there sufficient testing done that would assure parents that their kids aren't going to be harmed?
Yeah, so there is no long-term data because, as you point out, novel virus vaccines that were really based on technology that was decades old, so that's reassuring. But there is no trial that's longer than a year. However, we do have literally billions of people that have received vaccines around the world, adults, and then some children, and then we have the trials of children going on around the world. And what I will say is that any serious adverse effect we have started to see on average within 2 to 3 weeks of the vaccine, myocarditis, any clots, anything that we worry about, Stephanie, we see those within weeks. We will never have the answer for those, quote, long-term side effects for years. That's important. But you have to also weigh, what is the risk of my child or someone in my household or someone we know that could suffer from not just the bad effects of COVID, but some of the long-term consequences that we still don't understand, what we call long COVID syndrome. So it's a risk and benefit balance. Talk to your pediatrician. For me, my benefits outweighed the risks. That's why I vaccinated my children and recommend it to patients.
Do me a favor, please. Get out of here. Get out of here, man. Shit, I'm saying.
And the response that she gives, there is no trial over than a year. There has been R&D, so that's reassuring. That's reassuring. There's been years and years of R&D. Any adverse effect we tend to see within 1 to 2 weeks. Okay, so what does that do? We will never have the answers, and I think she points back to the testing, the just the amount of time of testing, but also she tries to say that the COVID stuff, the vaccine and the COVID infection is both kind of still early in kind of more of the long-term effects. She mentions the long COVID type symptoms that are still kind of unknown. And she ends with, what is the risk balance to my child? It's a risk and benefit balance. And I go back to the cons and pros list, right? With the kids, there's really, and even with adults with this point, with this vaccine, it doesn't prevent COVID. It doesn't prevent transmission. Again, so the whole mandate piece of it, and really putting pressure on taking away the freedom of someone to choose not only for themselves, but for their family doesn't seem right. So I just wanted to talk about those two pieces, and it more relates to the influence and propaganda and the way that the mainstream media just pushes these things.